Good evening, everybody. My name's Paul,
Good evening. This is Bev.
and we are here to share how to work with kidney stones today.
Ooh,
Woo!
wow.
Yes, sirree. So, little different format today because we didn't get a speaker, and so what we're going to do is we're going to read from our manual. So, and then we'll come back and share a little bit. Yeah.
Yep.
So the first page of our manual. Oh, you were going to talk about that. I'll show it here.
Yeah. So we thought we'd go through this, the first page of our workbook together, read it together, and I always want to mention our scribe Paula Taylor. She does a wonderful job writing up these cover pages for our workbooks. So here we go. Right, Paul? You want to
Yeah.
start?
No, you were starting.
Oh, I'm going to start. Sorry. We'll have to remind each other who's doing what. Okay, let's begin. So this is on kidney stones, of course. When there is too much waste and too little liquid in urine, a kidney stone can form. Kidney stones are irregularly shaped and can be as small as a grain of sand or as large as a golf ball.
Yikes.
Sometimes a stone will travel down a ureter, the tubes that connect the kidneys to the bladder, and become stuck there, blocking the flow of urine to the bladder and causing extreme pain. Sometimes a stone will travel to the bladder and be passed in the urine. Even small stones can cause excruciating pain as they are passed through the urinary system.
White men between the ages of 30 and 50 are most likely to get kidney stones, but anyone can develop them. Risk factors include family history, blockage in the urinary tract, not drinking enough liquids, eating a diet that includes the substances that form stones, such as high phosphate, high protein, high salt, and or high sugar, diabetes, obesity, gout, high blood pressure, osteoporosis, parathyroid disease, and certain surgical procedures and medications.
Hmm. There are four distinct types of kidney stones, which are caused by either diet, family history, or infection. Symptoms of having a kidney stone include severe pain on one side of the lower back, hematuria, blood in the urine, nausea, vomiting, fever, chills, foul smelling and or cloudy urine, and or vague pain in the back or stomach that will not go away. Kidney stones are diagnosed using urine tests, blood tests, and or imaging tests like CT, X-ray, or ultrasound.
Treatment varies depending on the size and severity of the stones. Sometimes nothing is done other than waiting to see if the stone will pass. Small stones can stay in the kidney for years without causing any symptoms or blockages.
Wow. For symptomatic stones, medications may be prescribed to manage nausea and vomiting, decrease pain, and relax the ureter to allow the stones to pass. Minimally invasive surgical procedures such as shock wave lithotripsy, whoa, using high energy sound waves to break stones
Huh.
into smaller fragments, and ureteroscopy, inserting a scope into the ureter to retrieve or destroy the stone, may be used for larger stones.
BioTouch has been shown to help reduce pain and can be used alongside any other treatments to help ease the symptoms of kidney stones. Wow. So we got a
So,
couple of little stories before we teach the sets of points, and on my end here, it was decades ago. We had the she was the head of the Department of Health Ministry in the Philippines, and she had heard about BioTouch, and the reason she came to the States to learn was because she had worked with somebody that had kidney stones, and they immediately passed without any discomfort. She was like, I mean, this is a MD in the Philippines. had seen stones numerous times and was amazed at how effective BioTouch was just with the first time learning them. So she came here, got certified, went back, printed some manuals there, started teaching classes, and
Wow.
she was totally awestruck by the power of BioTouch with kidney stones.
Well, my story is not so fortunate. However, my daughter developed a kidney stone a couple of years ago, and we were not living in the same town. But I went for a visit and did BioTouch with her. And she called me later and said that for the first time, the stone had moved. So we often wonder, she went ahead and had surgery. But she has often wondered if I had been able to do BioTouch with her on a regular basis during that time, if that stone wouldn't have passed and saved her going through that. She says, I don't know. I'm
Right.
pretty sure something would have happened other than surgery. So, you know,
So
you don't
it's
know.
interesting. So from both, I mean,
Yeah,
it can't hurt, So as we saw
right.
with your daughter, it moved it. She had a feeling, and maybe it just got her ready for the operation.
Well, right.
With the doctor in
Abs-
the Philippines, it actually helped it pass. But when it talks about radiation and zapping it or whatever, or pain reduction, I think BioTouch can be effective, and it's been shown to be effective. So we want to make sure
Definitely.
that you have this little tool in your toolbox for living
Yep.
a happy, healthy life. So we're just going to jump right into the sets of points. Now remember here, you can download the workbook here at justtouch.com/workbook. It's there for free for 30 days. If you're a member, you can download it anytime you want. So, and then this will always be shown on our website, this whole thing that we're going to talk about and show the points. So you can always refer to it later on. So what happens now is we're going to go back to the little techie room here, and Bev is going to teach the points while I play Mr. Tech Man here.
Yes, sir. Are we going to start with what is BioTouch?
Yes, take them right through the beginning. Let me get to
Okay.
that page.
Because, there's new people showing up all the time, and if this is their first introduction to BioTouch, we want to just give them so on page 6, the next page of the workbook, at the top, it says, what is BioTouch? And simply, it is a simple hands-on healing technique. You take the first 2 fingers of the hands and you touch very lightly on the skin like a butterfly. So it's very easy to learn, of course, and that this first bullet here we're going to talk about, it's easy to learn. Even children can learn and practice effectively, which is a marvel, because our whole purpose here, our mandate, is to get this into the families. And well, how amazing that children can help their parents, their grandparents, their friends. I mean, this is really an amazing technique. So even children can learn and practice and be effective. That's a very amazing thing about BioTouch. The second bullet, it's a complement to any healthcare program. We like to say that it is also very integrative, it's complementary, and you can indeed use it with any whatever you're going through, working with your physician, if you're on a special diet, if you're going and using other modalities, if you're on, prescriptions, whatever. BioTouch is only going to enhance that journey of healing experience for you. It's very safe, it's non-invasive, there's no side effects. So you can use it in conjunction with everything. It's quite amazing. It has no levels of ability, and this is what we really are trying to get across. Every single one of us already has what it takes to help someone with their pain, with their stress, and feeling cared for, and you will be effective the very first time you use it. The very first time you touch, you are going to be effective with BioTouch. So you don't come in, there's no special talent or knowledge. You just have to want to touch another human being and help them. That's the only really thing that's necessary to practice BioTouch. So, the moment that you learn this technique, you can immediately start to use it and you will be effective for that person. Now, this last bullet, BioTouch requires no special preparation. That you don't have to come in with a philosophy or a belief system or be in a positive state of mind. Nothing you have to prepare yourself or prepare a space. Nothing of that. BioTouch does not require that. It's just this amazing opportunity to be present with another human being, just without it, fixing anything or finagling anything. It's just human to human, right? So no particular anything going on. All you have to have is a wanting to help another person and help them with, care for them. That's really all that's necessary with BioTouch. Did you want to add anything, Paul?
No, we're good so far. We do have
Okay.
a lady with us, Dee, who's got constant problems with kidney stones. So I let her know
Wow.
if she needs any help in the future after learning these to just let us know.
Right. Absolutely right. So before we begin, let's go through the only things that are necessary to practice BioTouch. Again, you're going to use the first two fingers of both of your hands. You would always wash our hands before we want to practice BioTouch. Using those first two fingers, you're going to be touching lightly on the skin. And as you'll see, this technique has several sets of points that address conditions. And you will be using a light touch, holding each of these points 6 to 8 seconds. And we're ready. That's it. That's all that's required to practice BioTouch. We just think about touching someone lightly on the skin like a butterfly. The lighter you touch, the louder it resounds in the body. Crazy as that sounds, it's true. So let's this next page, we won't go into the terms that are used. This is a language that helps everybody understand how you apply those points on the body. We always do like to bring to your attention, though, the two people, this healing relationship includes two people. One doing the touching, we call that person the associate. And it's interesting because we have put a description from the dictionary about what an associate is. One often in the company with another, implying an intimacy or equality. And the second one having an interest in common with another. So one of the things you're going to find is BioTouch levels the playing field. A true relationship is one person giving and one person receiving, and both enjoy switching those roles. You cannot help another person without getting a benefit back. That's the love part. The other person in the relationship we call that the recipient. This is the person receiving the benefits of of BioTouch. So let's move on now, and we are going to, so Paul will be showing a video for each of these sets of points. It's a wonderful training tool that you will be that will be available to you if you want to learn how to address kidney stones this evening, or anything else for that matter. The very first thing that you always want to do after you wash your hands is perform what we call the greeting. This is literally a key, the key that opens up the body and says to the body, now we are going to be working and applying BioTouch. And so it sets up a harmony between the associate and the recipient in that relationship. So the only thing about the greeting is you're going to use one hand and it will be the dominant hand. So let's watch the video. Paul's going to put that on so we can all watch it together.
And before we do that, if you'll all notice, there's 2 pages to each set. One page is this little drawing that has the numbers that the video will show. And the second one has a description of where the points are and pictures of where people are touching. And if you'll notice down in the bottom of each page, it says click here to watch the video. And that is what we're going to show you. And if you click on that on your computer or your phone, it will take you to this same video. So.
The greeting is always performed at the beginning of each session. It's the only set that uses one hand and the only set that indicates which hand to use. The greeting is performed with the dominant hand. If you are right-handed, use your right hand. If you are left-handed, use your left hand. The greeting is made by touching at point 1, which is in the fleshy area just below the bottom of the breastbone or sternum. Hold this point for 6 to 8 seconds. Then, with the same 2 fingers, touch point 2 on the back. To find point 2, look for the big bone at the base of the neck. From here, move 1 to 1.5 inches to the left. This is point 2. Hold this point for 6 to 8 seconds. More than one associate may work with a recipient provided that all of the associates perform the greeting. If the associate or the recipient leaves the session, or if someone who hasn't done the greeting touches either the recipient or the associate, the greeting must be reestablished. Then the session may proceed from where it was interrupted.
Okay, now we have introduced the 2 bodies. And let's go ahead and we're going to go over the basic sets of points that we feel each month will address whatever specific condition. So you can, if you really want to learn BioTouch, you can always add whatever you think, but these are just the basics here to give you an idea, and you can immediately start to use with kidney stone, anybody who has any kidney stone problems. So the first set is called the metabolism set, and this is really important because this set helps the body to get rid of what it doesn't need or want, and then to assimilate what it needs. So it's a very important set to use to aid the body in getting rid of something like the kidney stone, or even the causes of what creates the kidney stones. So let's go ahead and watch the video.
The metabolism set can be used to help the body assimilate what it needs and eliminate what it doesn't need. The metabolism set has 2 steps. Step 1 involves touching points in matching fire along the large muscles on the front of the neck. Points 1 and 1 are located above the collarbone in the soft indentations on both sides of the notch at the top of the breastbone. Points 2 and 2 are halfway up the neck on the front of the large muscles. Points 3 and 3 are at the top of the neck on the front of the large muscles. The second step involves holding a point on the front of the body and touching points next to the spine on the back. Hold point X on the front of the body is on a line directly between where the nipples would be on a youth and is 1 to 2 inches to the left of the breastbone. Another way to find X is 1/3 of the way up the breastbone from greeting point 1 and 1 to 2 inches to the left of the breastbone. The points on the back are located next to the spine, forming a rectangle around the breakover point. The breakover point is where the bottom of the rib cage joins the spine and can be found by imagining a line directly through the body from greeting point 1. To perform step 2, find hold point X on the front of the body and touch points 1 through 4 on the back. Point 1 is approximately 1 to 2 inches up from the breakover point on the left spine muscle. Point 2 is directly across from point 1 on the right spine muscle. Point 3 is 2 to 3 inches below the breakover point on the right spine muscle. Point 4 is used to address blood sugar problems and is added to the other metabolism points when needed. It is located across from point 3 on the left spine muscle.
And I just want to make a point. If you're going to be using the metabolism just for that, you can just do the points 1, 2, and 3. So this is because of metabolism that we're talking about tonight is especially for kidney stones. So let's go to the next set. It's the infection. It's actually 3 sets, but remember in the cover page, we read that one of the causes of kidney stones is infection in the body. So we have the infection point. It is, if you look at the workbook, this point number 1 in that top little diagram is the infection point. So this is great because it addresses infections anywhere in the body, any kind of an infection in the body. So this would be a good one to use. So let's go ahead and watch the video on this.
The infection, allergy, and poison sets are 3 separate sets of points. They all share the same hold point, which is the same as greeting point 1, located in the fleshy area just below the base of the breastbone. As with all sets of points, these may be touched repeatedly. Infections of any kind anywhere in the body may be addressed by holding X and with the other hand touching point 1, which is at the base of the large muscle on the right side of the neck and slightly above and behind metabolism point 1. Allergies.
Okay. So the last set that we recommend is called the lower abdomen set. And of course, this is going to be important because this is where all that activity happens in the lower abdomen set. So this is a really great set to use for kidney stones. Anything that has to do with the urinary tract, the bladder, all of that, all of those organs. So let's go ahead and watch the video on this.
The lower abdomen set may be used to address any conditions or organs which are located between the navel and the pubic bone. This might include conditions of the reproductive organs, the colon, the bladder, or hernias. When working on the lower abdomen, it is helpful to press firmly into the flesh. But while working firmly, be careful not to cause discomfort to the recipient. The lower abdomen has 3 steps. Step 1. Locate hold point X, which is on the pubic bone. Do not press firmly on this point. While holding X, touch points 1 through 5 with the other hand. Point 1 is located just below the navel. Point 2 is in the soft tissue to the inside of the pelvic bone, low on the abdomen. Point 3 is the same point on the opposite side of the body. Point 4 is in the soft tissue just inside the high point of the hip bone. Point 5 is the same point on the opposite side of the body. Step 2. With the palm open and flat, slide the entire hand under the recipient's body and place the first 2 fingers of this hand in contact with point T on the sacrum triangle. Then with the other hand touch points 1 through 5 and X. Point 1 is located just below the navel. Point 2 is in the soft tissue to the inside of the pelvic bone, low on the abdomen. Point 3 is the same point on the opposite side of the Point 4 is in the soft tissue just inside the high point of the hip bone. Point 5 is the same point on the opposite side of the body. And X, which is on the pubic bone. After completing this step, enhancements in local work may be performed wherever a recipient is experiencing difficulties of any kind. Step 3. In matching fire, touch points 1 and X, points 2 and 3, and points 4 and 5.
Well, and that was perfect because that was two white men working on each other, which they say they're more apt to get.
30 and 50.
Right, they were between 30 and 50. So, and that little video there, it really shows how anybody can do this. I mean, there's a brotherhood, two guys working on each other, whatever the situation. And it's just such an awesome technique.
It is.
That anybody can do. And, we have some people that have posted online here, and we just want to let everybody know who's out there. We're here to help.
Yep, that's what we do.
Yes. We do these workshops the fourth Thursday of every month. They're all listed on our website now. You can go to the little thing up on top that says health conditions.
Yep.
These will always be a replay. But if you have any question, you contact us, and we have more than enough certified practitioners, certified instructors who will be happy to get back to you immediately. You don't get put into some queue and 3 weeks later somebody will get hold of you.
You get a real person.
A real person. So these are easy to learn, and we're here to help you do that. So
we are.
So this was a nice short little workshop.
I was going to say it was short and sweet. And again, we just want to remind you that you can take this workbook tonight and you can use those sets of points immediately. It's just follow those diagrams, look at that video, and start helping somebody right now.
And our new phrase, simple to learn, easy to use, and you'll notice results immediately.
I like it. And it's true, isn't it? It's very true. All of that is very true.
Yeah.
Yep.
All right, Bev, thank you very much for taking us through that.
Paul.
And thank you, everybody, for joining us. And we'll see you next month. We're doing Colitis. We have a wonderful speaker next week.
Yes.
Next month. So.
Yep.